Maybe you started out doing some standard exercises like some push-ups, bench press, maybe some pull-ups, and you noticed your wrists start to bother you, or maybe you started increasing your handstand volume or training a false grip of a muscle up, and your wrists again started to bother you a little bit. Here we're going to go over what might be contributing and some exercises to potentially help and kind of talk through what might be happening there.
Two things to immediately look at would be the strength and the range of motion of the wrists.
And then you also have to consider, even though it's farther away, the shoulder motion and the shoulder strength.
Lastly, I'd probably also look at just general nervous system adaptations. So for starters, just easy thing that you can kind of start to do yourself a little bit is just examining your wrist range of motion. So normally going backwards, it's approximately 60, 75 degrees from this angle to this ways. So my thumb doesn't have that range of motion, but that's just an easy way. If you're kind of just getting to about here-ish and then you're asking your body to push through this motion, it's kind of self-explanatory as to why there might be some discomfort while you're doing it. Then you factor in that you're also putting weight through it as well, and that's an overpressure into a position that your body's not as comfortable. So you might see that you get this far and you say, well, that's not enough. Usually once you're weight bearing, you'll see you can push it past that a little bit, and that's just the difference between active versus passive range of motion. So in an ideal world, you want to work in a manner in which you can have your active range of motion be very close to your passive range of motion, and that shows that you have a little more muscular control in that end range of position and can decrease the risk of injury a little bit. In addition to that, you also want to consider the neurodynamics, and we can get into that a little bit more later. You want to make sure, especially if you have a nervy stretch, some tingling kind of radiating up towards the neck or further up your arm, you might need to do different techniques to make sure that you address the nerve-specific component as well.
And then going back to that active and passive gap, a lot of people with wrist range of motion specifically, it's a very hard joint to have active and passive wrist range of motion be equal. I've seen it very few times, so keep that in mind. It's not going to be perfect, but as close as you can get is typically better. So in order to improve the wrist range of motion, there can be a couple different things. So to target the muscle, you can do a simple stretch. So you're going on your hands and your knees here to stretch out your wrist flexors, or the muscles that go this way, you're going to then stretch them the opposite direction. So you're putting your hands on the ground and then coming back, trying to keep your palms on the ground. You can kind of scoot a little bit closer to reduce the weight that you're putting through your hands as well to make it a little bit easier. You can also just hold like this too. Either one is fine. To stretch out your wrist extensors, you're going to go into wrist flexion, and you're going to put your hands on the ground and then shift back. Again, you can control the amount that you're putting through your wrist here with the amount of pressure. But you're going to feel a stretch up here. Again, you can also do the same thing. Here, keeping your elbows straight the whole time with both of those.
And ideally, having the wrist or the elbow straight with both of them will help increase the stretch. A lot of these muscles attach past the elbow, so purposefully making sure you have your elbow straight as well will help you feel that stretch a little bit more.
And then you can also specifically target the joint. You have a ton of bones and joints in the hand itself, but specifically targeting the wrist. A simple mobilization, you can also use a band I've seen for this, but I like to just use my hand. You're putting one hand on the ground, you're kind of creating a C shape here, and then you can kind of lean forward and rock that way. So coming here and rocking, and you're keeping your palm on the ground and you're giving a little bit of a pressure that way as you go to loosen up the joint specifically to allow more of that weight bearing position for the hands for things like push-ups and handstands and things like that. And then to strengthen throughout the full range of motion, you can either use a band or you can use like a small weight or dumbbell. You can do this using not your thigh to support your hand. You can do this just like kneeling in front of a bench or something like that. But pretty much in order to reduce the active passive gap with this motion here, from here to here, you can take a band and you're starting down and you're going all the way up, trying to go up as high as you can there. To reduce the active and passive gap going this way to this way, which is a little bit less important, but still just general overall wrist health, you can come here really focusing on curling up as far as you can. And then same thing, you can also do it with a weight. So here, coming up and then controlling it back down, same thing this way. Up, all the way up and all the way down. So like Steve mentioned before, minimizing that active and passive gap is going to be ideal, especially for like wrist strength. So strengthening those wrists with the band or the weight. And there are a ton of other different ways that you can strengthen the wrists too. But you might have seen someone also use some handstand blocks if you're training handstands. This actually allows the muscles to work a little bit better and it takes some of that pressure off the wrists too by doing that. So by being able to put those muscles in a more optimal position, you're then reducing the strain through the wrist and the forearm and things like that. So in a handstand on the ground, you have your fingers out straight, which means your wrist flexors and your finger flexors, things like this, are at their end range, right? So by doing this, they're not as at their end range, which means that they're in a more optimal position to be a little bit stronger. It's kind of similar to like a bicep curl. That very beginning is pretty hard because your muscles are passively insufficient, because they're just a little bit more on a stretch. And so that's why things like this can be helpful. They're not the end all be all. You still want to be able to do it on the ground, obviously, but that's why you might have seen someone, if you are in the hand balancing and handstanding world, you might have seen that.
There's a bunch of different ways to improve your wrist strength. I mean, tying into what Laura mentioned before, just using a weight and isolating just the wrist motion specifically is a very simple way of doing it, but probably not the most dynamic, so to speak. So that's something that in PT we'll do at our very low level, maybe especially injured patients. But when someone's not injured, you can definitely get a little bit more creative than that. Simple things like carries, hanging for periods of time. There's a lot of different ways you can make it more difficult. You can adjust or shoot for different targets from a time standpoint. You can change the scheme in terms of having a longer duration of time versus just a heavier weight for a shorter period of time. And also even just, again, not necessarily just using the weight, but say you are doing carries and just alternate just different fingers moving, and it can be the same thing while you're hanging. So there's a lot of different ways to do it and get creative. There's a reason there's hand specialists out there because of the myriad of different ways that you can work your grip strength and the different muscles for even just like your thumb or your fingers individually. So they all work in a bunch of different ways. I mean, there's pinch grip, tip grip, etc. We're not going to get into that today specifically, but I think the easiest way of saying it is you can screw around with a bunch of different positions, and that can all help, with your wrist strength, and then you can retest after trying that regimen out and seeing if it's helpful. Your shoulder motion is also going to play a really strong role in terms of the wrist. If you think about the positions you're getting into, your shoulder is dictating where your hand goes, right? So for example, I lift my shoulder up here and my wrist is in a different position. That's a very simple way of looking at it, but at the same time, the position my shoulder can get into for like a push-up, for example, if I don't have the extension range of motion, that might impact my wrist position as well. So examining, taking a look at your shoulder range of motion and your shoulder strength and activation is actually a really big role. We cue the shoulder blades a lot in physical therapy when we're doing corrective exercises, even with our wrist patients. Patient right now with a brachial plexus injury, and there's a lot of cueing at the shoulder blade, and that impacts his wrist discomfort when he's in weight bearing, doing either push-ups or quadruped walking, things like that. So it does play a really big role. We're not going to focus too much on that for today specifically this video, but it's just something else to think about if you have that range of motion.
With the shoulder specifically, we have done a full video going into overhead motion. So if you are interested in that, we'll go ahead and link that here. And then we also do have a band-only shoulder workout that might be helpful too. But consider as well when you're doing shoulder exercises, specifically focusing on its impact on the wrist, you can also just change the way that you're holding onto the weight or like band or holding onto the plate with like sideline external rotation. Instead of holding it just like this normally, you could hold it like this, and now you're working the wrist extensors a little bit more and your grip strength a little bit more. So little tweaks like that can also make a big difference. I know when I was rehabbing for my shoulder surgery, I used like the globes that I have, I looped it around the band and I was doing rows like that. So you can always be very creative with things like that too. If you do want additional exercises and a full program, I also do have a shoulder prehab program that I'll link below too. So peripheral nervous system adaptations can also play a role. So for example, with a false grip. So false grip is essentially a technique for muscle ups where you're holding the bar in the wrist crease versus in the palm of the hand. So pretend this is a bar, a normal hang, you're holding it here, but with a false grip, you're grabbing here. And so your hand is actually free. That way, when you get on top of the bar, you can transition into that dip pretty easily. So essentially, because our bodies aren't used to having our body weight through our wrist, it can get really tender for people. And I remember when I was first learning it, it also was pretty tender for, I believe, at least probably a couple of weeks as I was learning it. But That's basically because our nervous system is like, whoa, what is this new stimulus? I don't like it. It seems dangerous. But as we continue, our brain and our nervous system adapts and realizes, hey, it's not like dangerous, it's actually safe. So some people can actually get a little bit of bruising there. So especially in like circus arts and things like that, or like in gymnastics when you're doing stuff on bars, maybe learning a new skill and you're hitting your hips at a slightly different spot, you sometimes got a little bit of bruising there and then it went away as you kept on learning that skill. So this can happen, but our brain and our nervous system adapts. So you're not as sore and it's not as painful, and you don't get any bruising if you did have any bruising too. But again, if you do want to learn a little bit more about overhead shoulder motion, go ahead and watch this video here, and then I'll also link another video here with the band-only shoulder workout. But again, if you do want to learn more about the shoulder specifically, we do have the shoulder prehab program too that I'll link below.